So Heidi, of course, you were at a vaccination center today. Lots of people coming through. How are they handling it?
Yes, lots of people indeed, Shahan, and I think this speaks to the fact that the Sisonke trial is expected to end on Friday. This, of course, is the trial that allowed for the Johnson & Johnson vaccine to be administered as quickly as it did after that AstraZeneca vaccine was put on hold in the country. And first of all, we are seeing healthcare workers being vaccinated. This is part of the Sisonke trial. Phase 1, 1A and 1B also sees healthcare workers being vaccinated. But we do understand that vaccination centres have the capacity to take on an influx of people, and because we're also supposed to move into phase 2 as of Monday, there are some challenges with regards to many people registering, but they're not receiving a voucher. Of course, a hospital or a vaccination centre cannot solve that problem. It's support staff that needs to come through. But in terms of the number of vaccines that are coming through and the number of people wanting to get vaccinated, it seems that there's a balance there, and we know that the vaccination centre is able to handle that. But we got a chance to speak to the head of prevention control at Charlotte Maxeke, so let's have a listen.
In our vaccination center, remember that we are depending on RHI, which is a reproductive health research institution. Those are the research institution that is assisting us with the supply of vaccines. Yes, we do have vaccines as we speak that we can vaccinate the number of staff members that are coming over here. And then we come into the vaccinators. The institutions that are around us, they are within our cluster, are the ones that they are assisting with the vaccination of the vaccinees. So in terms of that, we are really capacitated. The only challenge that I can raise is the creation of vouchers. Majority of the people like we receive today, they don't have vouchers. And that's really delaying the line. We've got the vaccinators, but when coming to creation of voucher, remember, voucher is not created by us, it's created by EVDH, which is the responsibility of the National Department of Health. So majority of the people that are coming here, they don't have vouchers. And this really delayed the line. Once the line gets delayed, it is seen as if the vaccination process is slow. But if we can fix the issue of creation of vouchers, I can tell you the line will be as fast as a lightning.
So, Harry, we understand that the Johnson & Johnson vaccines have still not been released from the Eastern Cape. What's happening there?
Yes, so we know that over 1 million Johnson & Johnson vaccines were manufactured in the Aspen manufacturer, but we understand that that has still not been released. We did hear from the Health Minister, Dr. William Kiza, that was expected to be released already now, mid-May. But we know there's some kind of delay because of the international regulator needing to approve that. One must remember that the J&J vaccine was put on hold because of concerns over blood clots. So this is, of course, going to delay vaccine rollouts in some kind of way, because the only vaccines government has right now is the Pfizer vaccines that we receive, or we do receive every Sunday, over 300,000, and what's remaining of the 500,000 from the Sisonke trial. So it's going to be a little bit challenging for government to move forward into phase 2 as of Monday, because Pfizer is 2 doses, so they have to split the 300,000 in half, and of course it's going to be a little bit complicated for that. So hopefully we'll come to some kind of meet the deadline with regards to phase 2 and try and inoculate as many healthcare workers, because one must remember Sisonke only focuses on 500,000 healthcare workers, and then they move over to the rest of the vaccines, hoping it was J&J and the Pfizer that's available. But let's listen to Mia Milan on further details on that.
All right, we don't have that just yet, but let's continue with the people who are being vaccinated. I just spoke to Barry Shube about this, actually. So we know that healthcare workers only were supposed to be vaccinated through the Sisonke trial. Is that still happening? Is it only healthcare workers being vaccinated today, this week, until next Monday when we see over 60s?
Very key question, and we have actually reached out to the Department of Health and Professor Glenda Gray to get clarity on this matter. And the reason why, and hopefully we can bring up that OLAs, today when we got to the vaccination centre, we spotted a number of elderly people, and many would say that you do get older healthcare workers that are over the age of 60, so it doesn't necessarily mean that they fall into that category. But we spotted some people that were actually quite old and frail in wheelchairs and so forth. So the question was raised whether or not those above the age of 60 rocked up to the vaccination centre and started asking to be vaccinated. The word that we initially got was they cannot turn people away when they get to the vaccination centre. We've heard this from the health minister himself to say that if people want to register at a vaccination centre, they will be assisted and won't be turned away. But what we saw was people actually getting vaccinated, and of course the Department of Health just needs to get back to us with regards to that and whether or not it was indeed healthcare workers and if they're still in the healthcare sector or what's the status around that. But we'll obviously have to get more clarity on that because Phase 1 and Sisonke trials specifically for healthcare workers.
Yeah, I think we have the Mia Milan bite now. Just talk us into that one.
Yes, so the Mia Milan bite speaks specifically, Shahan, to the vaccines readily available in the country. So we know that we have 500,000 J&J vaccines, part of the Sisonke trial specifically for healthcare workers, and we know that over 395 healthcare workers have already been vaccinated of the Sisonke trial. So now that the J&J vaccines have not been released from the Aspen factory, over 1 million, what does this mean for Phase 2 and for the rest of the healthcare workers needing to be inoculated? We do know Pfizer is in the country, but let's listen to Mia Milan with regards to that.
We know that there are J&J vaccines waiting for us at the Aspen Eastern Cape plant, but that they cannot be released yet because there's the international verification precautionary process underway by international regulators, and no J&J vaccines can be released around the world before that process is not completed. So we don't know when it will be released, and I don't think that's the health department's fault. We really have to wait for this process to be concluded. But what we do know is that when those vaccines get released at the Eastern Cape plant, they're not going to be distributed to provinces from there. They're going to be flown to our Tambo, and from there they're going to be going into quarantine, and samples will go to the Bloemfontein lab to test for quality. And that process normally takes 5 to 7 days. So there's not a lot of time left for those J&J vaccines to be released and to be verified for quality and to reach sites in time. So from that, I would think that we're probably going to start with Pfizer, and we know that Pfizer vaccines will be used in urban sites because of the storage requirements, and J&J in rural sites. So we most likely, I would imagine, to be starting off with urban sites.
Wait, 395,320 healthcare workers vaccinated so far. Is that it?
Yes, Shahan, that's
Wow.
it. Let me give you another shocking stat.
Yeah.
Over the weekend, how many healthcare workers do you think were vaccinated over this past week?
It should have been at least 40,000 if I were to think about it.
49.
49?
Yes.
Oh, wow. Okay. And government says that the vaccination sites are ready, rocking, rolling.
Ready, yes.
All good, hey?
Yes.
Okay. All right. We'll see. Thanks for that. Appreciate it. Heidi Jokos.